Hello, this is Alicia Sam, and you're watching HW News. After COVID 19, we are dealing with another disease of monkeypox. The World Health Organization has sounded its highest level of alert for monkeypox and declared the virus as a public health emergency of international concern. The disease was first reported in West and Central Africa, but lately it spread in Europe and certain parts of Asia, has led to major concerns for countries which are already recovering from the COVID 19 hit outbreak of another such disease, has added to their worries. In India, three cases of monkeypox have been reported from Delhi and Kerala, whereas two suspected cases have been found in Telangana and Noida. Indian government has held high-level meeting to combat what could potentially be the outbreak of another pandemic. Centre has cautioned all state and union territory authorities while urging them to increase surveillance. Several states also issued alerts on Tuesday. But what exactly is monkeypox virus? How does it spread and what are the myths going on around about the disease? We are going to talk about this in today's video. Joining us is health educator and Dr. Sangram Patil from England. Welcome to the show, Doctor. As we see, the monkeypox virus is spreading day by day worldwide. What exactly is this monkeypox virus and how deadly is this virus?
So, Alisha, monkeypox virus is not the new virus. It's been there for
Yes.
last 5, 6 decades, but
Uh-huh.
it has been only restricted to certain parts of Africa, like central areas and western areas. So Nigeria
Right.
and all those areas. But recently, there has been an outbreak, and it started in May 2022. As soon as the COVID restrictions were lifted, and there were few functions, gatherings in European and American countries, this virus has spread, possibly coming from some African person who carried it, and then it spread to other regions. So it's quite rare infection to have in for human beings, because
Right.
usually it is restricted to the animal reservoirs, and then it keeps circulating in local areas among the human population as well in those African regions.
Right.
Outside Africa, it hasn't spread to this degree. It has never
Right.
spread outside, but this time it's gone to probably some 16,500 cases now total.
Mm,
That's the latest figure.
exactly.
The reason why it is called monkeypox is not because it originated in monkeys, but in 1950s there were
Mm,
some batch of monkeys that was being used for research purpose. This virus was isolated first time in them. That's why it was labeled as monkeypox. But it's actually more prevalent in squirrels and rodents and rats, those animals. So nothing to do with monkeys specifically.
right.
This is similar to smallpox that we have been able to eradicate in the past,
Mm,
the last century. So it's quite rare type of infection, but it is spreading now. So there's possibly a mutation of one of the variants that is there in the western part of Africa, and that is spreading and that is causing this news now. So WHO has declared it as an emergency.
So, how deadly can this virus be? Like I asked.
Uh, Till now, as we know, there have been some 80 or 90, 80 to 90 deaths in Africa that have been possibly linked to monkeypox, but that's not proven yet. Outside Africa, in Europe and in America and in India, we haven't got any reports of death till now. It's not as deadly as the smallpox variant, because smallpox and monkeypox, they belong to the same group of family of viruses, but this is not as deadly as that. But it can affect certain populations badly, but not as a whole population. It's not that significantly harmful to the human population.
Right. How does monkeypox spread from person to person? Is it like contagious?
Yes, it is a contagious disease. It spreads somewhat similar to COVID 19, but not to that extent. So it spreads via the droplets which are dropped out from the infected person's saliva in the form of, through cough or sneeze or maybe loud talk. But the degree to which it is transmitted is very low. So if person has to be in front of infected person for many hours to get infected. There are other ways of transmission as well. If a person stays in close skin to skin contact with infected person, that is why it is spreading in this homosexual group of people who are spreading it from one person to other. Another route of spread is through infected, contaminated clothes or linens or items of use. So saliva drops on them, or some body fluids drop on them, and then they can infect as well. There can be a zoonosis, that means transmission from infected animals to human beings. And if these infected animals they bite us, or if we come in contact with the contaminated skin or any fur, other animal products, or if we happen to eat meat of these animals which is not perfectly cooked, then that can also cause infection. So overall, sexually, though it is not meant to be called as sexually transmitted disease, but the close intimacy during sexual contact is responsible for uh, most of the transmission in current scenario.
Right. How worried should we be about this monkeypox outbreak?
Obviously, when WHO says this is a international global health emergency, then it is a worry. But it is not same worry as COVID-19, pandemic declaration or health emergency declaration by WHO. But not to say that this is a less worry than COVID-19. At the moment, it looks like it is an emergency, but not same as COVID-19. But I would say that this monkeypox has a potential to grow, to potential to infect more and more human populations. In with the current variant we have, it's not spreading very rapidly, it is not killing people. But if it mutates, if it settles down in some country, in some animal population, then it can mutate. And if the mutant variant is rapidly spreading and more dangerous, more risky, then it can result into a situation which we had during the times of smallpox. Though it is
Right.
not there now, and we can't exactly say that it will result into a smallpox like condition, but there is a potential. And some researchers think that if people aren't immunized against smallpox, that population can be at risk if some dangerous mutations do happen in coming years. So we should be worried about it, and we should, the governments must take measures to stop the spread and to make it sure that it doesn't settle down in human population or in animal population of the respective countries.
Right. What are the symptoms that can tell me that I am infected with monkeypox?
Yeah, so Alisha, first of all, the people who are at risk of this infection is the homosexual population or people with multiple sexual partners. So this group are people who are in close contact with this group. If some family member has this kind of behavior, or belongs to that group, then they
Right.
should be very careful in noting certain symptoms. And the typical symptoms of monkeypox are like flu. So person after getting in close contact with infected person within 3 weeks is expected to have flu-like symptoms like fever, headache, body ache, swelling of the glands, like you get lymph glands swelling, chills along with the fever. They feel very tired, and this is followed by a rash. And rash can be usually a typical rash. It starts with a simple rash with blisters, and then they burst out, and then it crusts, and then there is a healing in next 2 to 3 weeks. But it can be atypical rash. So it can be confused with chickenpox or other sexually transmitted infections like syphilis or other rashes. So if someone thinks they can be at risk, or they have someone in the house or close proximity who is at risk, then and if they get this kind of symptoms with rash, then they should contact the health personnel quickly. Usually people will recover in few weeks, 3 to 4 weeks, and then they will become non-infective to others. While someone has a symptom, including the flu-like symptoms or rash, they can infect other people. And when the rash heals completely with a normal skin, then they become non-infective. So we have to isolate these people till they are symptomatic. That's a very important thing to stop the spread of this virus. And the principles are similar to COVID-19 isolation. So we have to follow all the instructions uh, till the rash is healed and the symptoms are gone.
Yes. All right, doctor. So, like you said, it is also monkeypox is also found in animals, right? So, if I have a pet, and let's say, can my pet be infected with monkeypox?
Yeah, it is, Alicia, it is difficult to say which pets will get infected and they will actually host the virus at this stage because we haven't got any data. The natural wild animals, rodent, monkeys, squirrels, rats, they can definitely host this virus, but not that the animals in our vicinity, in Indian scenario, are infected with this virus at the moment. Like we had a confusion, there was a rumor that people shouldn't eat chicken or eggs or fish because they can have this virus, COVID-19 virus, and people stopped eating non-vegetarian diet. So that wasn't true. That was just a myth. Similarly, till the time we have evidence that these animals have got infected and they are hosting this virus, we don't need to worry about the animals in our vicinity, including the pet animals. But it's difficult to say now whether the cats and dogs will be infected and they can act as a host for this virus till we have more evidence coming from anywhere in the world.
Right. Like you said, rumors about COVID 19. We had rumors about COVID 19. There is also myths that has been spreading because of monkeypox. So, can you just help us bust some of the myths related to monkeypox? So, I'll ask you some of the myths and you can tell me if it's true or if it's not.
Yeah, go on.
Yeah. There's no treatment available for monkeypox. How true is that?
It's actually partially true because monkeypox virus, as I said, it is very similar to smallpox virus in many aspects because it's from the same family.
Hmm.
So whatever was effective or is effective for smallpox, it doesn't exist now, but we have treatments for smallpox. The same things have been approved in many Western countries now for treatment of monkeypox as an emergency treatment, and they do help, including the vaccine. So there are some antiviral medications which are useful for severe cases or people who might be at risk of developing severe forms of monkeypox, such as there is a ticovirimat, that is a very known antiviral that is actually been tested for smallpox, but it is also used for monkeypox and it is useful. There is a antibody available against smallpox, that is vaccinia antibody, and that is also known to be effective in monkeypox. We don't know how effective it is in the current scenario with the current variant, but with previous exposures that has been used and that was useful. And there are few more antiviral agents like cidofovir or few more, and they can be used for these people. And there is obviously a vaccine for smallpox that is very effective in monkeypox as well, up to 85% effectivity, though that hasn't been tested with the current variant. It was tested with the previous variants.
Yeah, thank you, doctor. Also, like you said, having a very active sexual, many multiple partners actually, sexual multiple partners. So, is monkeypox only transmitted sexually, or
No, Alicia, as I said, in fact, we don't call it as a sexually transmitted disease because
disease?
we do not have evidence that it is actually the virus is carried in semen or vaginal fluids. We know it is carried in saliva, but we
Right.
don't have evidence that actual sexual intercourse transmits this disease. So that is not called as STD, sexually transmitted disease. But the close intimacy, the contact, skin to skin contact, and mouth to mouth contact, or with other routes of sexual act, these routes encourage transmission of the virus. That intimacy is responsible for transmission rather than the sexual intercourse itself. So, and that is why this gay and homosexual population is getting affected at the moment. Almost in certain countries, almost 99% of infections are taking place in homosexual or bisexual male population. There have been reports of some females and some children getting affected with this, but it's mainly concentrated in the bisexual or homosexual male population.
Right. Is monkeypox a fatal? Like, are there chances? Does this have, just like COVID-19, if you get infected severely, is it fatal enough?
Yeah. So, as I said, there have been reports of deaths from African countries, but no
Right.
deaths have been reported outside Africa. And we don't know the reasons. Could be, already immunocompromised HIV population might have been infected there in Africa, and those people might have died from some monkeypox or some other related causes. So, overall, monkeypox can be fatal in certain groups if people are immunocompromised, like HIV population, or other causes of immunocompromise, including people on immunosuppression therapies or cancers or major kidney liver problems or other immunological conditions. People who are under 8, so children under 8 are supposed to be at risk of severe complications. Pregnant females are also at risk population, so they can develop abortions and premature deaths and other complications of pregnancy from this infection. Monkeypox can affect, no, apart from skin scarring, it can lead to corneal scarring. So the vision can be lost permanently, and it can, it's a respiratory infection, so it can affect the lungs and cause pneumonia. And in severe immunocompromised people, that can result in severe ARDS and other sepsis-like complications that we see in COVID. But in comparison to COVID, it is not as dangerous as the COVID was, and nowhere near smallpox, because smallpox earlier had almost 30% mortality, and it killed millions of, uh, in Indian words, it killed almost crores of people that time before we had a vaccine, and even with vaccine, people were dying, and we had to struggle a lot to eliminate it. So we're nowhere close to that situation, but if it mutates in future and gives rise to some strain that is hazardous, that is fatal, then we will be in a serious situation that time.
Also, doctor, who are at more, like, more susceptible to
Yeah.
this
So
monkeypox
I've
disease?
already answered this. So gay community, people who are in a multiple sexual relationship, so prostitutes, obviously, because they will meet people who have these habits, and families of these people who come in close contact with these communities. uh, People who are who have got a immunocompromised state, under 8, and pregnant breastfeeding ladies, these are at severe risk from monkeypox.
Right. Like, is this monkeypox outbreak a wake up call for more other pandemics to come? So, we have dealt with COVID-19, we are still dealing with it. Is more such pandemics more ahead to come? And is monkeypox a wake up call for uh,
Yes,
us?
certainly, Alicia, it is a wake-up call. That is why WHO has announced it as a global health emergency. And though it is not pandemic situation at the moment, and we don't quite know, we're not sure with this speed this will actually result in a pandemic. It will be more like epidemics in few areas of the world. But if it keeps spreading and if certain variants come that spread faster, then it can result in a pandemic. But this pandemic will be different from COVID-19 pandemic. Like COVID-19 resulted in lockdown and complete shutdown of most things in the world. Uh, that will not be expected with the current variant of monkeypox, because it spreads very slow. It spreads in certain communities with very close contact, whereas COVID-19 was quite different. So even one person sneezed in a car, all the 5 6 people in the car could get COVID infection. On the hospital wards, if one patient has COVID-19, the whole ward can get infected. So there will be outbreak in the ward, in the hospitals. That is not expected from this variant of monkeypox, but certainly it has a potential for pandemic. And as has been said earlier by various experts and scientists in epidemiology, that the way we are treating our natural resources, jungles, water resources, and with the population migrating from one corner of the world to the other, these pandemics are more likely to come more often, and this is going to be a global problem in near future with climate change and the misuse and abuse of the natural resources, as well as the animal along with humans, the animals are being transported from one part to other. That will also result in more pandemic like situations in future.
Right. Thank you so much for your time, Doctor. Definitely, our viewers will be educated and find it interesting. And thank you for busting all the myths about monkeypox.
Thank you for having me.
Thank
Thanks,
you.
Alicia. Take
Thank
care.
you.